Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzo.
I'm Dr. Bradway.
Okay, we got a procedure video.
Yes.
A little procedure.
Yep, everyone's been asking about it.
Yeah.
People are nervous about it.
I gotta get my clips out.
Gotta get my staples removed.
Is it gonna hurt?
Okay.
What happens? How do you take the staples out?
Okay.
First of all, why do we use staples?
So, I mean, it's a fair question. I think some people use sutures. I think I like because it's a reliable way to do multiple points of contact.
Yeah.
And usually I do a running suture right below the skin, similar to you.
Yeah.
Just helps hold the skin together.
Closed wounds, and it's a little metal. Metal is nice and benign. The skin doesn't get too excited about metal. Sometimes with suture, the skin will get a little bit inflamed and irritated.
Yep.
But the skin doesn't seem to mind the tiny, thin metal that we use for staples in the skin.
And so when people get them taken up, Paul, do they get put to sleep for it?
No. It's when we put them in, I would say that might hurt.
Sure.
Fortunately, you're anesthetized when they go in.
Yes.
But taking them out doesn't seem to hurt as much.
Will you freeze the area when I?
No.
Should I take a pill before I come?
Don't need to.
Okay.
Don't need to. It's pretty. I mean, I've never had staples removed.
I know.
So here we are.
We do this
yammering on about it.
Oh, that's fine.
But from the reaction I see from people, most of the time.
I would agree. Every now and then you do have some people that are like, wow, that really hurt.
Yeah.
And I think if you wait too long, sometimes that can be sore.
Yeah.
And as your swelling goes down, often the staples can start to pull a little bit. And even it helps improve your motion. By the time they're out, there's a little less pulling. So often you'll get an extra 5 degrees of flexion after they're out.
You feel better.
Okay.
Okay. Enough about that. Let's
watch a video. Okay. So we have a kind patient who agreed to have this filmed, and one of our staff in the fracture clinic was taking it out. So here we go.
My first question would be, how did you train the Oompa Loompas to remove the staples?
Yeah.
And how did you get Oompa Loompas to work in your clinic?
It's actually a Smurf.
Oh.
So you'll see that the metal staple remover device just pushes on the staple, bends the two edges up, and then it removes it from the skin. A lot of people will look at this and say, how come there's like one long incision and then one little incision? And that's because we do computer-assisted surgery, and there's 2 ways. You can either put the tibial pin through the bottom part of the incision or through a separate stab incision. It's not a mistake. Sometimes patients ask that.
Did you miss?
Did you miss? Yeah.
Yeah, so you can see that device. What it does is it basically, it's a 3-point bend on the staple. So it bends the staple in the middle and pulls the 2 prongs out of the skin quickly and almost painlessly.
Yeah, and every now and then there'll be a little trickle of blood from those little holes. Usually the wound will be cleaned afterwards, and then if it's dry, there'll be no dressing. If there's a little bit of bleeding, sometimes a dry dressing for 24 hours.
Right, and this person is obviously not anesthetized, totally awake, and just enjoying the relaxing staple removal procedure.
Yeah. Just have
switch directions.
Yeah,
see that?
Yeah.
Sneak up from the top.
Come from the top.
It's a nice looking incision, Dr. Weenie.
Thank you. Thank you. We do take pride in our scars. It's the least important part, but the only part people see. That's what I tell them.
Yeah, so that's it. Staples come out. It's that easy. So don't stress about it. Don't worry about it. Don't lose sleep over it.
Nope.
You're going to get those staples removed and you're going to feel fine. It's not going to hurt too much.
You're actually going to feel better after.
Yeah, all right? And don't worry about it when you get them put in and you see them in there and worry, oh my God, how are these things ever going to come out?
That's right.
They're coming out.
Right. So if you like this video, please like it, subscribe to our channel, and leave a comment about your staple experience.
And please don't try this at home.
No.
Let a professional take those staples out.
Absolutely.
And remember, you are in charge of your own health.
We'll see you next time.